So now to the issue of COVID-19 long haulers. We don't yet have large-scale estimates on how many people are suffering lingering and in some cases debilitating symptoms from COVID-19, but it's becoming clear that these are not isolated cases. Mike, as you've looked into this issue, what have you learned about this lingering symptoms associated with the coronavirus?
First of all, I think that this is an area that of all aspects of COVID-19 related disease, we have really been the slowest to understand what the implications are. When we had the house on fire in places like Lombardy in Italy, in New York, and in places like that in March and April, there was so much incredible work that got done in the intensive care units by intensivists who were simultaneously caring for patients, but learning about what we could do better for outcomes. And one of the reasons why we see today such a major improvement in the mortality rates from those earliest days without the presence of a blockbuster drug is because we learned how to handle these patients from a clinical standpoint, how to do mechanical ventilation, what drugs we do have, how to best use them. So from that perspective, that has been such a major success in COVID-19. But understanding the long-term consequences of this disease has really been very, very slow to understand the implications of that long-term situation. And it's only now that we're coming to appreciate that. When we hear the name long haulers, I, for one, was wanting to know, where did it come from? Because I think it surely is a good description of what's happening. The best we can find is that in the June 4th issue of The Atlantic, a story was written about it. And at that point, some of the people who were impacted and reporting on Facebook and so forth refer to themselves as long-termers or long haulers. And eventually the long hauler term became accepted. These individuals have an illness that is reminiscent of it. I want to say it's the same because it's not, of what we used to call chronic fatigue syndrome. Today we have a new name for that, myalgic encephalomyelitis. We have had experience in the past with the chronic consequences of infectious diseases. For example, in the 1950s, after an outbreak in a London hospital of some infectious agent never determined, there was this outbreak of myalgic encephalomyelitis, a mouthful, basically EM. And it was a condition that, with further study, and in fact in the 1980s, mid-1980s, a similar outbreak occurred in the Lake Tahoe region, and the CDC called it chronic fatigue syndrome. That is today the ME-CFS combination that we talk about with this kind of condition, which I'll describe more in a moment. But today we estimate that there may be up to 2.5 million Americans who have ME-CFS. And this whole long haulers experience does make us think, wow, there are some real similarities here. It's been estimated that up to about 10% of mild coronavirus cases who are not admitted to hospitals have reported symptoms lasting more than 4 weeks. A number of hospitalized cases reported continuing symptoms of 8 or more weeks following discharge. And that number is going to continue to change as we have more time to follow these individuals. While there surely are recoveries, there are a number who are continuing on. When you look at the kind of persistent health problems we're talking about, they include respiratory symptoms and conditions such as a chronic cough, shortness of breath, lung inflammation, fibrosis, and pulmonary vascular disease. Clearly cardiovascular symptoms and disease such as chest tightness, acute myocarditis, and heart failure. There's been protracted loss or change of smell and taste. In terms of mental health problems, we see depression, anxiety, and cognitive difficulties, inflammatory disease such as myalgias, the multi-system inflammatory syndrome, which we've seen in kids, Guillain-Barré syndrome. We also see gastrointestinal disturbances with diarrhea, continuing headaches, fatigue, weakness, and sleeplessness, liver and kidney dysfunction, clotting disorders and thrombosis, lymphadenopathy, and even skin rashes. And these are not one common constellation that everyone has. Some have more than others. And the key thing, though, is that they basically are experiencing these days to weeks after infection. Now, when you think about the fact that we have about 6.5 million reported cases of infection in this country, and yet we know that we have, many, many more really infected than that. Probably, 1 out of 7 to 1 out of 10 patients ever are documented. Therefore, you can understand that if we look at that, that's 30 to 70 million Americans who have been infected to date. And if that 10% number holds, which I think it may or may not once we look at the denominator more carefully, but it's still a lot of people. This is a real challenge in terms of the number of people who are experiencing this kind of problem. In terms of why this might be occurring, it's not clear yet. There are 3 possible avenues that we've explored with regard to what might be causing this. The first one is the virus is gone, but the immune system is stuck in a lingering overreactive state. One is that maybe we could harbor the virus in a reservoir organ that we don't know about. There's no evidence to support that at this time. And finally, that fragments of viral material might trigger an immune overreaction, meaning as we're clearing that viral debris, it's still there. It's going to be a very important, we try to understand what the etiology is for this. And just as we've seen with EM, chronic fatigue syndrome, it's going to be a challenge. We have to realize that this is going to be a challenge. If you look at what we've seen so far in terms of cases with long haulers disease, let me make it really clear. One of the major challenges around the mental health side of this is so many of these people were not tested in the early days of the pandemic. We didn't have testing available. And so they've tried to go in and seek a medical care for this chronic condition, and they've, in many cases, been written off, and they shouldn't have been. Now, if they test today for the virus, obviously they're not going to find it. At the same time, this is where we should be testing people with antibody to find out if, in fact, these people might have had evidence there. And many people who have had infection, who have become long haulers, have now been found to be positive via antibody testing. So that's an important thing. If you're listening to this, you think you're a long hauler, you didn't have a PCR test done when you first became ill, do not give up. Go back in, demand to have an antibody test, and to see if that's the case of what's gone on. Now, if we look at the situation in terms of what we might be talking about here, the survey data is really limited in that it's only been a limited period of time that we've had since the time that you got infected till now. One study that was reported this past week out of England found that about 10% of mild COVID cases who weren't admitted to the hospital reported symptoms lasting more than 4 weeks. A number of the hospitalized patients reported symptoms for more than 8 weeks following discharge. And they had a list of 12 items. And as I just pointed out, there are many of the same that I just summarized for you. Also, if you look at a survey that was done by the CDC, reported in the July 31st Morbidity and Mortality Report, that critical science-based report, this was a survey done between March and June of 2020 when the case numbers were fewer. And again, there wasn't as much time for them to have developed long-term long haulers-like symptoms. There they found in a telephone survey of 292 non-hospitalized symptomatic adults who did have a positive test result, that 35% of those respondents reported ongoing symptoms up to 3 weeks after testing. So you can see that this has continued. Our experience with this, I guess, shouldn't be a total surprise. If you look at SARS-CoV-1, the cause of SARS back in 2003, there have been now a 15-year study looking at the issue of heart-related conditions that have occurred in people who were SARS cases back in 2003. And 4.6% of these still had visible lesions on their lungs from their original infection, meaning damage that occurred. And 38% had reduced diffusion capacity. So this was a long-term type of problem that they had. When a study that was just published this week from Austria found that at 6 weeks, 88% of long haulers had evidence of lung disease based on radiographs or x-rays. At 12 weeks, 56% still did. So it's improving. I think if there's anything I can share with this group that's really important is if you have these symptoms again, you do need to be seen. And there are a growing number of locations around the country, around the world, that are now specializing in seeing long haulers. Get on the internet, identify those places that have expertise in this, who are very willing to dive into what you're experiencing and provide, I think, the very best opportunity for you to get the better care. If this is a deal, again, dealing with ongoing immunologic reaction, whatever. People ask often, well, is this really different than we've seen with other infectious agents? Yes, we have seen post-viral syndromes with other viruses such as influenza, SARS, MERS, West Nile, mononucleosis, but not at the level we're seeing here. This is unprecedented. This is really remarkable. And I think that that's the kind of situation where it hopefully will not continue, that we'll see gradual improvement that will occur over time. But for right now, at least, it is real. And where this all takes me to is the fact that today, a number of these long haulers are young, healthy individuals who are never hospitalized. The same people who are not afraid of getting infected now because they don't see any of their friends necessarily in the hospital. They don't see them in an intensive care unit. And if I had one message, why not to get infected? If I can't get it across to you that, number one, you do run the risk of being seriously ill, grant you it's low, and dying. You may transmit this virus to others that you love and care about who are susceptible to serious disease. At least think about for yourself the issue of this long hauler's condition. I know far too many people myself who are professionals in the medical care area who literally are at home on oxygen right now 8 to 10 weeks after having been a patient with mild illness, not even hospitalized. And so as we continue to study this, and we will keep you updated on this, we will keep you posted on what we're finding. This is a really important area. For those who have these symptoms, please know that there are people who believe you, there are people who understand what you're going through, and there are people here who want to help you. Don't be one of those individuals who goes to a care provider who says, well, there's nothing I can do. You're not positive by virus. Know that you can still be tested for antibody. This is one of those few times where I'd tell you this is important. And get into one of these studies, get into one of these centers that are working on this, and know that from a physiologic standpoint, your body, that this is an important area to study and to learn what can be done, and also take care of your head. This is one of those ones where the brain fog that's been reported, it is important that you have the emotional support to get through this. So long haulers are a big deal. They're very important, and they are going to continue to grow in numbers substantially. So please don't get infected with this virus, young adults. Please don't. This is unfortunately one of your options, and you don't want this. You just don't want this.